Hi, hello, welcome back. This is Dr. Ejaz Pasha here from MF Super Speciality Dental Care. We have been here since more than 25 years, so it's an honor to talk to you on this topic very much related to kids. It's called pulpectomy and pulpotomy. It's technical terms, but it's a little difficult for the common man to understand because when they come for the infection of the milk tooth, so the first thing is we are supposed to teach them about the presence of the milk tooth and the permanent tooth, and this has been covered in our previous videos. Please look into it. So today I'm going to stick to the procedures pulpectomy and pulpotomy. In pulpotomy, we have something called as three different layers of the tooth, that is enamel, dentine and pulp. If the infection stays in the enamel and dentine, okay, and it is very mild and slightly either it is touching or it's very close to the pulp, then we remove that whole infection in the enamel and dentine, as well as the mild infection or the mild exposure of the pulp is been removed, and we give a dressing called calcium hydroxide with iodine, so that, and we leave it for about week's time to 10 days so that it starts healing and gives up a new layer of dentine. Now this procedure followed with after 10 days or a week, we take out the upper layer, that is the zinc oxide cement or the temporary cement layer, keep the lower layer which I just mentioned about it, and then replace with the glass ionomer cement or the composite, or sometimes the both. Now this procedure is called pulpotomy, Pulpotomy. Now coming to pulpectomy, it is similar to something called as root canal or RCT in adult tooth. But the only difference here is what we put inside the tooth, that is in a root canal. After cleaning, we put a material that is called gattaparcha in adult teeth. In kids, because the root gets resorbed, okay, so that is the reason we don't put this non-resorbable material. So we are supposed to put something called as resorbable material, which as the child grows, the root gets resorbed, so the material also gets resorbed, and that is biocompatible. So we fill it up with something called as calcium hydroxide again, or zinc oxide. Now zinc oxide doesn't get resorbed, so we prefer to have it and give a calcium hydroxide. And another disadvantage is it's an irritation to some of the kids. So the best material would be putting a calcium hydroxide inside the canals. Now this procedure of cleaning, putting the calcium hydroxide and closing up with the excess or the outer layer of the tooth structure, and then giving a crown, this whole thing gives to pulpotomy procedure. So I hope you understood the difference between the pulpectomy and pulpotomy, and in relation to root canal which is done in adults. Thank you so much.